Good afternoon, everyone. Welcome to the course. Let's begin. So, basically, the idea of this 5-day free course is that I just want to brush up the skills. I just want to talk about certain things. I want to bring in back the essence of what we are supposed to do for this exam. I just want to give a brief introduction about what's going on. Now, I do know that there are three categories of candidates: one who have given the exam before, two who have just passed Plab 1 and they're just entering into the whole scenario of Plab 2 preparation, and the third category is people who haven't given the exam before. They booked their exams, and because of the pandemic, they were not able to give their exams. So these are the three categories which of candidates which are there. Now, what we are going to do in this session for today is that we are going to look at a few points. We are going to just review and revise everything. What are we expected to do? What is Plab 2? So, what are the things I should keep in mind? How do I choose an academy? How do I prepare myself? Now, prior to the pandemic, okay, I wouldn't say I want you to forget everything what happened. You can remember everything because, as such, from what I read, even up to last night, from what I read on the GMC UK website, doesn't look like there are many changes. Okay, the core of Lab 2 is still the same. It is an objective, clinical, structured examination. Okay, and the domains across which you are being tested are the same. So I won't say that there is going to be a lot much of a difference, but what I'm saying is that I would definitely recommend tricks and some tips which you should incorporate into your preparation going forward. Okay, so firstly, let's start with what is Plab 2. So, like I said, Plab 2 is basically objective, structured clinical examination. Now, in this OSCE, what happens is it's just as you present cases when you are on hospital rounds as a intern. So I'm sure most of us on the session today, most of us on the group today, we have all finished our first year of internship. Most of your duties include that of an intern. Most of what you have done as an intern, you have presented cases, written case sheets, written prescriptions, attended OPD, attended ER, and you were posted across various departments in during the course of your internship. So basically, this exam is focused at that level. It is focused at the level of an intern. Okay. Now, if we go through a hierarchy of ranks in the UK, especially, so it starts with medical student, foundation year level 1, foundation year level 2, senior house officer, registrar, consultant. Okay. Here, for the purpose of Lab 2, you are being tested at foundation year level 2, which means in your undergraduate days, what you have studied plus the internship work, what you have done, you are being tested for both these things. Okay, so as you all know, as an intern, a typical day starts with rounds, case presentations, OPD, admissions, discharges, and patient interaction. Okay, so broadly, these are the six categories. Sometimes you may be asked to supervise or you may be asked to perform procedures. Sometimes you may also be asked to teach medical students. Okay, so these are the broad categories of a typical day in an intern's life. Okay, now these broad categories, they are not different in the UK also. They are the same. The only little differences which are there is some sort of emotional aspects, psychological aspects which we are exposed to in our native countries, those things need to be worked on when you come to practice in the UK. Okay. For example, I'll just give you a very quick example. Okay. If back home you were taught that emotions and feelings of patients is not something you need to address, right? Here, that is something you need to work on. That is something you need to address. Now, about this, I want to say something really important. Okay, in the olden days, science and pseudoscience was considered to be two different entities. But now, science and pseudoscience go hand in hand, which means that over here, each and every individual case that you tackle, each and every individual job that you do, you are going to apply emotions, you are going to acknowledge them, you're going to work on them, you're going to talk about them. Okay, you have to do all these things over here. This is basically what you're being judged for. If you do not, if you think or you have a doubt about what I'm saying, please look up functional neurological disorders. And this is basically science and pseudoscience together, where they talk about how even a little bit of hurtful comment, even a little bit of aggression can bring about so many emotions in a human being. And as doctors, this is really, really important that we keep in mind. Why? Because now we are traveling to a country different than our own, and we want to portray our best presentation forward. Okay, keep your best person forward. So this is briefly about Plab 2. Okay, so what is Plab 2? It looks at you, how do you manage the tasks of an intern, and how do you apply human components like emotions, compassion, cues of body language into your practice, into your scientific. This is basically what is Plab 2. Now, I do know that the definition on the GMC UK website is quite different. The summation of what is Plab 2, if I want to explain foreign medical graduates, it's this. It doesn't matter any country you come from, okay? There are different ways where medicine is preached and practiced in different parts of the world, but right now there are changes being incorporated everywhere, okay? Everywhere people are more and more aware of. So please remember, this is not just for this exam, but after you pass your exam, moving forward, how do you want to present yourself? What do you want to do? All these things are going to be taken into account. Okay, at every step of the way, after you pass your Plab 2 exam, this practice is going to help you a lot. Okay, so this is about briefly what is expected on the exam day. Okay, now I hope that I have given you a summation of what are you expected to do. And if you have any questions, you can leave them on the chat box. I will answer them after the session is over. Okay? Take 10 minutes and I'll answer your questions. But I hope that I've been clear about what is Plab 2. Okay. Next, let's move on to the part about preparation. So, how do you prepare for this exam? What do you do? What are the things that you need? What are the resources that you need? What are the references that you need? You have already been tested about your clinical knowledge. This is what the GMC UK website says. We have already tested you about your clinical knowledge, and that is why you were able to clear the first part of the exam. Okay. Right now, we are testing you for your format and for your presentation. This is what we are testing you for. We are testing you for your communication skills. We are testing you for your human being like skills, which you are going to put into your scientific practice. This is what basically you're being tested for. So, how do you prepare for something like that? Now, if you personally ask me, I would say the best way to prepare for this exam is to open your Oxford Handbook of Clinical Medicine and read even those small boxes which have information which you think, or I used to think, or we think is not important. Okay, in the Oxford Handbook of Clinical Medicine, there are small boxes either in the beginning of a particular system or in the end of a particular system or way in between. There are some small footnotes. There are, these colorful boxes which have some information in them, and that information usually contains. So it's there. It's everything is there in that book. If you go through the first few pages of that book, it talks about ethics, it talks about principles of ethics, it talks about the Hippocratic Oath, it talks about medical examinations, what are you supposed to do, what is expected of you. It even has phrases you want to use for your interpersonal skills. All those things are there in that book. Okay, so I recommend that beginning to end, it doesn't matter, but please do read Oxford Handbook of Clinical Medicine, the first few pages at least, because it gives you a very good idea about what you are expected to do. Okay, so this is something I feel which is very important. Okay, I feel that it is not stressed or emphasized much, but I do feel that every book has a magic in itself, and this magic is only experienced when you open the book. So please open the book and please do read the first few pages of the book. They are very, very useful. Oxford Handbook of Clinical Medicine, they are very useful. You should take a look at it. You must read it. That's my personal recommendation, that this is a very good resource. If you want to find out about painkillers, if you want to find out about the pain ladder, then once again, Oxford Handbook of Clinical Medicine is the most important book. It has all the information that you need for pain management, especially in palliative care. Okay, now this is just an example. You can just take a look at it. You can just open your Oxford Handbook of Clinical Medicine after the session is over. You can read the pages of pain management in palliative care and you can tell me what you think about it. Because when you read something in a book and then you watch a video about someone demonstrating it, especially people who actually work for the NHS, who are endorsed by the NHS website, it tends to stick into your minds much better. So this is my first step. Okay, how do I prepare myself? What do I do? The first thing you do is this: you open your book and you read it. Now I'm someone who advocates reading books. I'm someone who advocates reading and updating yourself with what is mentioned on the GMC UK website. I always encourage candidates to do that, because not only does this help you in keeping yourself updated with what is expected of you, but you would also know. That's why I always recommend that you open the website, you read the website, you read everything that they say, then you open your OHCM and you read what it says, and you watch some videos, YouTube videos basically, of the GMC UK and of the NHS and of the NHS. Okay, so basically you have GMC UK on YouTube, you have NHS on YouTube. There are many videos over there, and there is a lot of guidance over there on how you should talk, what you should do, what are the principles involved, what are you being tested for, the clues, the hints, everything is there in these two websites. They are the original websites of GMC UK, and what they say on it should be easier to comprehend when you have some prior reading knowledge. Okay, so this is my recommendation, and this is also how I prepared for the exam. So I definitely do recommend that you take a look at these two things. Okay, the rest of your preparation needs to be at least 3 hours a day of active studying. Okay, you have to study 3 hours a day. Now, these 3 hours, it can either be divided into 1 hour in the morning, one in the afternoon, and one in the evening, but you have to spend at least 3 hours a day to prepare yourself for the exam. Now, what do I do? How do I know what to prepare? What are the topics I can be quizzed for? Once again, if you go onto the GMC UK website, you will find a Plab 2 blueprint, and it says that there are topics which include topics of Plab 1 and Plab 2, but it's a good idea to always have that blueprint and to look at it, because most of the questions, I'm sure you all know by now, most of the scenarios you can comprehend by now what they're going to be like. So anyway, the blueprint is important. If you start, the first component of the blueprint, it talks about blood and its components, hematology basically. And if you see the contents of the blood and its components, hematology components which are being asked, right, those questions have already come in the exam. Those topics are already there, so you do have an idea what are you being quizzed for. So it's either anemia, it is tiredness, it is leukemia. So these three topics are there in the OHCM, so you can quickly look at what are the signs and symptoms, what is the treatment, what is the management, and then go back to your original resource. Now, your original resource may come from an academy that you have signed up for. It could be any academy that you chose to sign up with and get the content of previous years' questions and how candidates before you performed and scored really well. Okay, and you could give it a reading. And if you think that reading is not enough, I still do not understand what's going on. It's very difficult for me to process what is written in my resource and what is written in OHCM. Cannot do this. Then please remember you have to replace every negative thought that you have about your preparation with a positive thought. Please don't think that you cannot do this. Think that I wasn't doing this, now I am doing this, so this definitely will help me move forward. Because what happens is when you read a textbook, right? When you read a textbook, you read through the content and you remember it. Now, when you read a resource which you have obtained from some other source, there is a chance you may forget what you read on the resource. So, what you do is in the exam, you may not remember what your original source stated, but you will definitely remember something from the textbook, and you can quote that in simple words which you will use to talk to your family members or relatives. You can just talk in simple words and explain to the simulator in front of you about that condition, and you can still pass the exam. Okay, you can still pass. You can do it. It's not wrong. Now, so this is something which I personally advocate. I have personally done this, and this has definitely helped me and got me a good score also in the exam. Okay, what happens on the day of the exam? Okay, so basically you have about 16 to 18 stations. You may have two rest stations. Each station is of 8 minutes. You are given a minute and a half to read the question on the door. The question on the door is very, very clear. It comes in four categories. The question itself is divided into four categories. It talks about your position, where you are located, who is the patient inside, and what are you supposed to do. Okay. Now, this is much better than the actual internship day, the actual internship work that you do. Because when you work as an intern, you have no idea what you're going to face on that particular day. You don't know what you're going to see in the OPD. You don't know what kind of procedure you're going to do. No guaranteed list is given to you when you wake up in the morning that as an intern, today this is what you're supposed to do, right? So it's full of surprises. But here in the exam, you are given a minute and a half to read the question and to know already what to expect inside. So when you have this minute and a half, you are expected to plan accordingly what you're going to do and enter and perform accordingly. Okay. So as we move forward, in the course, I will tell you in detail about how do you proceed with different doors and what do you do in different situations. Now, moving on, how do I choose an academy? How do you choose an academy? Word of mouth, what you think is the best for you, distance wise, rating wise. So it's a personal choice. I do not have any recommendations, but what I would definitely say is to always see how often the academy's notes are being updated. So that is something you need to look into, because if you have information that is already freely accessible to you by the NHS website, right, and you find that the same information is available in your resources which you obtain from the academy, then please do think twice before proceeding with the payment. Okay, I would prefer that personally. I would prefer making a payment where I know that this resource is not available to me for free, and I can definitely make my money worth when I pay this. Okay, so that's what I have to say about Academy. Now, moving on, how do I improve myself with the feedback I receive? Okay, so when you have your materials, when you have been preparing, and when you are preparing, you do take a mock exam before you take the exam, you get some feedback, or when you have practiced with your practice partners, you get some feedback about yourself. The feedback may not always be positive. When you get a negative feedback about anything, think about the ways you can improve this. A good idea would be, once again, to look at the YouTube channel of the NHS. Okay, there are many ways expressed over there on how to talk, what are you expected to do, and those small certain things you can incorporate in your exam and still pass your exam. Okay, so this would be one thing I strongly recommend all of you to do that. In fact, I do recommend that, because those points which they say on the channel, those are very valuable points. They really really bring out the best in you, because when you hear them and when you read your resource through the point of view which they have expressed in the video, you yourself will bring about a lot of changes in your practice, in your self. Okay, so this is one thing that I recommend that you do. The other thing that I recommend is to continue practicing in spite of receiving a bad feedback. Okay, so continue what you're doing, show consistency. Consistency is very, very important. Okay, just think that this was just one of the many scenarios which I can encounter and I cannot do well. However, in the exam, I will still have about 12 to 14 scenarios where I can excel. Okay, so please remember that you will have a chance to prove yourself. It's not the end of the world, and one bad feedback in one particular scenario should not put you off, should not make you give up practice altogether. Okay, if you find difficulty in finding a practice partner, if you find difficulty in opting for a mock exam, if you find all these things difficult, please don't worry. You can still practice on your own. You can still practice at your comfort. You could use, if you feel that you do lack even that kind of a support, then remember, it's the best thing. The best candidate is the one who is self-reliant. Okay. Now we all have situations where at one point or the other we are expected to, we have no other option but to be self-reliant. So please remember, even if you are reading and you have nothing else, no other resource, but you have the resource of reading and you are actively reading, this is also going to help you a lot. Okay, this is definitely going to help you a lot. Reading helps, it does help, it helps in a lot of aspects. It teaches you new things, it teaches you new words, new concepts, all of which you can utilize for your exam. Okay, about the books, I already told you the books that really help: Oxford Handbook of Clinical Medicine, Oxford Handbook of Clinical Specialties. If you want, you can also read Oxford Handbook of Foundation Year Program. However, Oxford Handbook of Foundation Year Program is a little bit confusing to read. This is my opinion. But the other two books, OHCM and OHCS, they are really good books. They have everything that you need to know. Most of the signs and symptoms which you are going to hear right inside in the cubicles when you start your exam, would be exactly from the OHCS and OHCM. Okay, how do you, if you have a differential that you need to discuss, even the symptoms of differentials, right? All those are mentioned very, very well in OHCM and OHCS. That is a book I definitely recommend everybody to read. If you cannot read or you do not have time to read those entire books, if there is somebody who hasn't cleared their exam in the first attempt and they want to know what they should do now, what is that one thing which I should do differently now? Once again, please open your book and see the magic happen. Open these books. Really, it will help you. It will help you the way you talk, it will help you the way you conduct yourself in the exam, and it definitely, definitely, definitely helps. I cannot emphasize the importance of opening these books even for Plab 2. Okay, very, very important. This was a brief talk about Plab 2 and about preparation, about choosing the academy, about resources.